Our bodies are just incredible healing machines, right? You got a paper cut, you scrape your knee, and most of the time, they just patch themselves up without us even thinking about it. But what happens when that amazing process just stops? What happens when a wound decides it's not going anywhere? Well, that's not just a hypothetical question. It's a reality that millions of people are facing. Right now, they're caught in this kind of hidden health crisis, living with wounds that have become a constant, painful part of their lives. And these aren't just stubborn wounds, they have a specific name. Medically speaking, here's the line in the sand. If a wound shows zero signs of healing after 8 weeks, and that's even with getting the right care, it's officially called a chronic wound. Think about that. 8 weeks. That's 2 full months where the body's natural repair crew has just stalled out. To get what's going wrong, picture this. Normal healing is like a well-run construction project with 3 phases. First, you've got inflammation. That's the crew clearing the site. Then comes proliferation. They're laying down the new foundation. And finally, remodeling, all the finishing touches. A chronic wound? It's like that construction site where the workers just walked off the job halfway through. It's stuck, abandoned in one of those first phases, and it just can't move forward. And this is not some rare, obscure problem. We're talking about a huge, often invisible public health crisis. It affects millions of people. And for them, it means constant pain, a really tough quality of life, and it puts this massive strain on our healthcare systems. So to even begin to help, we've got to figure out what's really happening under the surface. And to do that, we basically have to become detectives. Yeah, really. We need to decode the clues that the wound itself is giving us, because every single chronic wound is telling a story about a much bigger problem. And this, right here, gets to the absolute heart of it. A clinician can't just slap a bandage on one of these and call it a day. Nope. They have to play detective. They have to read the clues. Where is it? What does it look like? What are the symptoms? To find the real culprit. Because the wound isn't the disease, it's the smoking gun. So let's look at the two most wanted culprits. They're both types of leg ulcers, but they are worlds apart. On one side, you have the venous leg ulcer. This is caused by weak veins that can't push blood back up to the heart. The clue? It usually shows up on the inner, lower part of the leg. On the other side, you've got the arterial leg ulcer. This is caused by blocked arteries that stop oxygen-rich blood from getting to the foot in the first place. And these guys? They tend to pop up on the toes, the foot, or the outer ankle. See? Different causes, different locations, and totally different clues for our detective to follow. And that's not the whole lineup. We also have to be on the lookout for diabetic foot ulcers, which come from nerve and blood vessel damage. Then there are pressure ulcers. Those form over bony spots like your heels from just constant pressure. And, believe it or not, even tumor wounds caused by cancer. It's a whole rogues gallery, and each one has its own telltale signs. Okay, so our detective has followed the clues and ID'd the bad guy. Now it's time to switch gears from investigation to action. It's time for a battle plan. And to heal a chronic wound, you have to fight on 2 fronts at the very same time. The strategy, when you think about it, is just beautifully logical. You can't just focus on one thing and hope for the best. You have to launch this coordinated 2-pronged attack. You go after the underlying disease that's causing the whole mess, and at the same time, you're treating the wound itself with everything you've got. It's a classic pincer movement. Now, when we talk about treating the wound itself, we have to talk about a major enemy. Its name is biofilm, and this is not just a run-of-the-mill infection. Oh no, it is a sophisticated, slimy fortress that bacteria literally build over the wound to protect themselves. This shield hides them from your immune system, it blocks antibiotics, and it brings the whole healing project to a dead stop. So front number 1 in our attack is what's called causal therapy. This is about taking down the mastermind. It means getting a proper diagnosis and then actually treating that underlying venous disease, or that arterial blockage, or getting the patient's diabetes under control. And it also includes critical support, like compression therapy for vein issues, or special beds to relieve pressure. This is the long-term solution. Then you have front number 2, Local therapy. This is the battle right there on the ground. It involves carefully cleaning the wound, that's a process called debridement, to get rid of dead tissue and, most importantly, to physically smash that biofilm fortress we talked about. After that, it's all about managing the moisture. You want it just right, not too wet, not too dry, and then protecting it with a modern wound dressing to create the perfect environment for the body to finally get back to work. So, after all that incredible effort, the wound finally closes. Is the battle won? Is it over? Well, not quite. Now we have to shift our focus to winning the long game. Look, healing the wound is a huge victory, no doubt about it. But the ultimate victory is making sure another one never shows up. Because the very same things that caused the first wound, they're usually still there, which means the risk of it happening all over again is incredibly high. And this is where the patient really becomes the hero of their own story. Winning this long game really comes down to 5 key pillars of self-care. It all starts with proactive skincare, keeping your body's first line of defense tough. Then, getting the right nutrition to give your body the building blocks it needs. Daily movement is huge for circulation. If diabetes is in the picture, specialized foot care is an absolute must. And finally, managing weight helps reduce all that pressure on the body. These aren't just ideas, they're powerful, doable actions. And in the end, it all boils down to this, right here. When you educate patients, when they understand their condition, their personal risks, and how to use these 5 pillars, you give them power, you give them control. An informed, empowered patient is, without a doubt, the single best defense against chronic wounds. So we'll end with a question for all of us to think about. Now that we know the clues to look for, now that we understand the battle plan and how to prevent the fight from even starting, what do we do with this knowledge? How can we be more aware, more empathetic, and more supportive of the millions of people out there living quietly with these stubborn, silent wounds?